Broadcasting live from the Business RadioX studios in Phoenix, Arizona, it's time for Phoenix Business Radio, spotlighting the city's best businesses and the people who lead them.
Hello and welcome to Phoenix Business Radio, broadcasting live from the Mac 6 Conscious Workspace in Tempe, Arizona, where we help build businesses and connect you with the right people. Today, I'm very excited to be speaking with President of Apricus Health, Dr. Kishlay Anand. Welcome, sir. How are you?
Doing good, Karen. Thank you so much for having me on the show today.
I'm excited to get to know you better and to learn about all the great things you're doing on behalf of families and individuals. And I mentioned Apricus Health, but also Apricus Health is another company that you own and operate as well.
Yes, so there are both sister companies. So Karen, as you know, I'm a practicing physician and physician by heart, and got into being a physician just because of passion and the difference as a physician I could make in terms of community and by making people's life better. And as part of that journey, that has evolved into understanding some of the difficulties with healthcare. And as you may be aware, that solutions can come from all places. And most recently, as you saw, Haven, which was an enterprise pulled together by JP Morgan Chase, Berkshire Hathaway, and Amazon to really focus on a very critical area of increasing premiums for the employer, had some struggles, but these are real challenges looking for solutions. And what we have been able to do with ACOS MD, we have been able to create some innovative solutions to help employers take control of their medical spend while getting more access to care for their employees and a better member experience. And similarly with Apricus Health, the idea is to use virtual as well as telehealth and care navigation to improve access to care and improve quality outcomes at the same time, bending the cost curve in healthcare, which is a big challenge for us as a nation.
And how long have you been at the telemedicine and the virtual medicine? Well before COVID.
As I said, I was interested in telehealth since I was in med school. So my journey has been across continents. So I grew up in India. I went to a medical school called All India Institute of Medical Sciences, and AIMS is the mecca of medicine. It takes 50 students from all over India and literally has been ranked number one. The good part as part of that is you get exposed to a variety of healthcare issues and are able to develop creativity to solve them. And with that, from there, moved to US, so got the perspective of healthcare in India, the challenges in India, and then moving US, being in practice, got exposed to the challenges in US. And understanding some of these challenges on a day-to-day basis pushed me to find creatively solutions to these problems. And that was the genesis of this piece. And truly, since medical school, I've been intrigued by telehealth and always felt that it needs to be integrated in the care continuum. So just like when we talk about healthcare delivery, the healthcare, we saw gradual migration from these big structure known as hospital to more home-based care. And when we talk about care delivery today, we talk of the care continuum from home to a enterprise or hospital. And there's a big gamut of care delivery within that. And so getting exposed and integrating the telehealth was a intent from med school, and definitely we have been kind of exposed to that. And telehealth has been around for long periods, and finally COVID has pushed it towards prime time. I started ACOS roughly 5 years back, and we looked at the traditional telehealth models. And so far in the past, telehealth was used for episodic purposes. And what I mean by that is that if you have cough and cold, use telehealth. Basically, you can call a physician, So in that model for the episodic care, definitely telehealth bring convenience. So young mom, now she does not have to pack all the 5 kids, go and wait for a few hours in urgent care or emergency to seek care. Now they are able to talk to a doctor, get the script sent to the pharmacy and get the care conveniently. So convenience and access is brought by the episodic nature, but truly the bending the cost curve is not possible in that model. So we saw some of the strength of episodic model, but we also saw need of integrating telehealth more in the care continuum in terms of managing the chronic conditions. And truly, if you look at the healthcare costs, we say that 20% of the population utilizes 80% of the healthcare cost. So now, how can we use telehealth effectively using technology and manage this high-risk group becomes an innovative project. And that's what we kind of embarked upon between Apricus and ACOS.
Fantastic. Tell me more about the value-based care model. What does that mean, and how does that benefit us as families and patients?
So Karen, as you know, the current model of most of our healthcare is fee-for-service. You go see a physician, and it's a transactional. Basically, physicians get paid by the health insurance a certain dollar amount. It does not have any accountability in terms of outcomes. And this becomes really critical with the escalating healthcare cost overall in the population, is that we want to tie the healthcare delivery enterprises together and hold each other accountable to also better the healthcare of our communities. And that's where that's the model of value-based setting, where basically you do get your fee-for-service support, but there are significant incentive towards bettering the outcomes of the community and really focusing on how to improve the healthcare and well-being of the individual. And this has taken some time for the adoption, and there are different degrees of this. There are enterprises like us where we go full risk. We take the full upside and downside in this, in terms with payers to work with them and manage, as we say, part A and part B, the hospital side as well as the professional side of risk. And we have developed a very innovative model to not compromise the access to care, improve it, at the same time bend the cost curve.
Mm-hmm. Tell me about the increase of telehealth protocols and how virtual healthcare can then reduce hospital visits. I mean, I'm getting a sense of it, but do you have some examples and speak to that a little bit for us?
Yep. And so in the winter time, we see that all our emergency departments are packed. And there's usually, most of them have a 24-hour wait and are on diversion. And that's just because there's a low acuity, intermediate acuity mixed with high acuity patients basically awaiting and in front of the emergency department. Truly, the best process would be to start that initial triage at home, where a patient can get in front of a triage tool, which we have built, and be able to be directed to the most appropriate level of care. And most people, as you know, healthcare navigation is a challenge. People, even if I have to look for a specialist, I'll be making calls to my friend to figure out who is the person I should go for that particular condition. So having somebody to help you navigate in your healthcare journey and guide you to the most appropriate place for care, whether it's on the acuity side or specialty side, is of significant value. And those are some of the models which are innovative, which we have been able to incorporate within our healthcare delivery to really improve the member experience, at the same time bend the cost curve in healthcare. Because if people have low acuity and they can be managed via telehealth, then they do not need to go. And if they can receive the care at home, now they are not going to the urgent care or emergency department to seek care for some common minor issues. And that allows for people with high acuity to basically receive care in these high acute conditions.
Yeah, I was just thinking about that for folks that I know who do everything they can to avoid the doctor, so that, you know, they're self-managing, they're looking up Dr. Google and trying to self-manage and not taking preventative measures and staying in conversation with a medical professional to make sure that they're doing everything they can to stay healthy. And then when it's too late, they don't have an established relationship with a doctor, so they're showing up at the emergency room, right? And what we're talking about is establish those relationships and have those conversations with the providers, so that when something comes up, you already know who to call, what, you know, the relationships there, they can get you to the support and help that you need. And a lot of it can all be handled visually through meetings like this. Is that correct? As well as just back and forth via email? Is that how that works?
Yeah, Karen, I think you bring a very good point. Healthcare, most of us ignore it. For the first part of our life, we ignore the wellness prevention, and we see physicians mostly as people who deliver secondary prevention. When you have a condition, you go to them, and we have not really focused on primary care as the gatekeeper for healthcare and wellness. And that's where I think that has kind of put us on the back. Basically, that has escalated the healthcare cost. Because if you're proactive and you're working with a primary care on wellness aspect, it will delay a lot of the chronic condition, whether it's diabetes. So there is a renewed focus on basically driving value to the primary care and working hand in hand with them for weight loss, which is associated with multiple chronic conditions, including heart disease, diabetes. There are now robust program. I was just talking to Dr. Dean Arnish. He has put together an intensive cardiac program, which basically reverses the cardiovascular risk factors. Similarly, as we discussed diabetes prevention, there are multiple of these conditions where we can work. If we put primary care as a focus for primary prevention in terms of and focus on wellness, we can really improve the outcome and health of our community, improve the longevity of the population, as well as the health of the population. And that's where we feel that we need to focus. And that's where ACOS and Apricus has taken lead on the employer side to incorporate wellness in the care delivery and make this process more proactive, develop that relationship one-to-one with primary care. And then in our process, what we do is when we onboard a member, each member gets assigned a care team. And at the baseline, we do a health risk assessment and profiling and understand the risk factors associated with that individual. And then we customize care plan for them if they need weight loss help, smoking cessation help. We bring all that proactively to really improve their long-term outcomes.
Is that the same person that, is that similar to or the same thing as a personal healthcare navigator?
Yes. So as part of our care team, each member is assigned a care navigator where they have one-to-one relationship. And this is the person who basically helps them with the coordination aspect, helps them schedule their appointments, helps them basically keep up to date with things happening on their healthcare side, as well as medication refills. And, basically, if they need with any direction or navigating that healthcare experience, this is the person they fall back to. If they have chronic conditions, then we usually bring one of our care managers or care nurse manager who get actively involved with one-to-one relationship, focusing on incorporating programs which will help better manage the chronic conditions. And if they're really high acuity patients, then we also develop some house call and home health programs for them to bring care at home for them.
My husband was in a trauma intensive care unit for a month last year, October. And then after that, in a post-acute facility for a month afterwards. He's doing well today, but it was very traumatic and expensive. And I had no idea how to navigate the hospitals, all the specialists, the medication, all of that. And I was very grateful for exactly what you're describing, to have someone assigned to me to make sure that I kind of knew how to, what's coming next and how to manage this and who to talk to. And especially now in this COVID era where our awareness and hopefully our behaviors and habits have changed so that we are being safer and healthier and looking out for our wellness right now. So it's wonderful that the companies that you've created, and again, being on the forefront and the leader in this industry as it relates to telemedicine, is wonderful because it also encourages more accessibility, right? I don't think it's without mentioning that this makes it so much more accessible for folks, regardless of where they live.
And Karen, as you said, healthcare is so personal to us. You never know when you're on the receiving end. And I have, just like you, I have a young family, and my wife was diagnosed with a chronic condition, and just that puts so much stress on you, and you have to go through and navigate at that time. And so this is something which we all would be on the receiving side. And that's where, our goal is always to bring empathy and that relationship, because we are all humans and we will get sick. And definitely being a physician does not give you a shield, a protection. So we understand that together we have to make our healthcare delivery better and bring innovation, which basically brings this experience better for all of us and helps a solution which is good for community. And that's what we have been focused on. That's what brings my passion into this, that I have been on the receiving end, Karen, just like you, and truly feel that healthcare delivery can be better. And by bringing some of these small alignment and innovation, you can really improve the experience around healthcare, at the same time, the outcomes, without escalating the cost.
So much bundled in that last statement. Innovation is paramount as it relates to medicine and health. Expedience, we all appreciate that, and improving the workflow and the communication, all that. But what you're pointing out is so important. It's that healthcare, we can have innovation, we can have expediency, but if we do it at the expense of the relationship and that personal care, we're not really benefiting anybody. So I love to hear that that's at the forefront, this whole value-based model, and the fact that it's personal for you, right? You are a family man yourself, and knowing how important it is that we have those relationships makes a big difference. And I'm thinking from the perspective of the employer, right? All day in and day out, I get to have conversations here at Business RadioX with leading enterprises, small businesses, even our 3 major universities, talking with those high-level executives about culture and how important it is to have value-based led organizations. And it's no different than what we're talking right here, Dr. Anand, that our employees, our stakeholders matter. And if we're ignoring or not paying attention to the things that happen for them at home, then we're doing each other a disservice. So how great it is that you're looking at it through that same lens. And I'm pleased. I've been at this for 3 years here at Phoenix Business RadioX, and I can't think of a company in the over 2,000 executive leaders that I've interviewed who haven't similarly said the same thing. We have to care about our stakeholders. We have to be innovative. We have to lead the pack and continue to find ways to bring costs down, make it cost effective, but also do well by the people, the constituents and the people that matter the most. So thank you so much for bringing that. As I share that little summary, is there anything else that you think to share? And I have more questions, but does anything else come to mind?
So Karen, as you know, for most small to medium-sized employers, COVID has put a lot of burden, most of us in some way or from whichever sector you are, entertainment, retail, there's a lot of pressure built on us. And this is the time we have to find some innovative ways to bring value back to our employees. This has definitely put the focus on healthcare and the healthcare spend. And there's an innovative way to deliver healthcare to the employees where you provide them coverage without basically, in a fiscal responsible way. It can be done. And that's what we have with the ACOS employer value-based model. What we have done is showcased cost containment with improved member experience and outcomes, which is very critical in this employer space and much needed currently. And similarly, if you think healthcare is broke, and medical benefit is broken, workers' compensation, which is another arm for the most of the employers and a significant spend, and each dollar paid in claims in workers' comp leads to $3 rise in premiums. So there are innovative ways to manage members better, and it does not need to come at a cost of not giving the care, because that's a misconception by some organization where they feel that by basically by taking care away you can do better long term, and that's something which we feel is kind of misplaced. And truly giving the right care at the right time in the long term brings the best value to organizations, and that's what we have seen work. And that's what I would like to highlight, that there are solutions which can be put forward, and that's what we have done with ACOS, and we have showcased that in our white paper on employer medical benefits as well as in workers' compensation.
So good. Let's shift a little bit and talk about senior healthcare management. I've had the benefit of speaking to all different industries and verticals, and our seniors are often I don't want to use the word neglected, but isolated is probably a better word. What is the importance of senior healthcare management? How does that fit into everything that you're doing?
So, Karen, we all have a life cycle. We start young and we will age. So, truly, again, as I said, healthcare is personal. Solutions, and some of that is selfish. You create solutions today for your tomorrow in some way or form. To just see that this is not something which you're going to be requiring is, I think, again, misplaced. And some of us think that we have eternal youth is not true. So, again, in Arizona, we have, as you can imagine, with the our overall demographic, we do have significant senior population, and we have to basically they have some unique healthcare needs, and definitely, as you know, as we age, all of us, we basically our healthcare needs are increased, and those are the times when you need more help,
Yes.
and that's where our focus is on our senior program. We are very focused in terms of understanding what are some of the pain points in terms of simple things like medication access. The cost of medication, as most of us at policy level realize that the medication adherence and access to the appropriate medication is a big challenge because people are not able to afford medication. And also, in today's healthcare journey, a senior has to go see a patient to see their doctor in multiple places because the specialists spread out.
Mm-hmm.
From there, they'll go for their lab testing to another location. They have to drive to that, and then other diagnostic they have to keep. It's a very prolonged process where for simple blood work, diagnostics, and for medication they have to go to 3-4 locations. Some of us will feel that's routine and that's how it should be. But when we see it day in and out, I feel there's a better way to deliver that model for the seniors where we can bring all this in one location. And that's what we have attempted with Apricus Health Network and Apricus Medical Group, where we are trying to, so we have taken basically as part of CMS innovation project, we have picked up Maricopa and Pinal County to create an innovative model of care delivery where we can give our seniors a better healthcare experience by providing comprehensive primary care clinics where all these services are available in one location. So now you don't have to go to multiple locations for these services. So that's convenient. It also helps improve healthcare outcomes. If you have your medications, you'll have less, basically you will have just a patient population like heart failure. If you're out of your medication, your situation will worsen and you'll need hospitalization. So by improving access to the medication, it also helps them. So we have partnered with an innovative pharmacy company, Lighton RX, which just getting started in Arizona, which gives 15 medication for free to our members. And rest of they do a free home delivery of medications within, for most part, same day. In some of the remote areas, it may take another day for deliver. So these are some partnerships which basically come together to create an innovative solution and meet the need of our senior population. We do, as I said, on the senior side, try to understand their social needs like medical transport. A lot of the seniors need help with transportation. So again, utilizing the same care navigation function and giving them a hotline if they have any social needs, we are able to help them meet that, which is a big value to them. So our goal is to bring that 360 care model where we are looking not at just them from one aspect, but we look them overall as an individual, as a person, and see how we can deliver most value to them. So for all our members, our primary care does the annual physical, then we understand their healthcare needs. If they have one or more chronic conditions, we have a very robust personalized chronic care management program where we basically proactively work with them. We provide counseling and education on chronic conditions. At the same time, monitor vitals and metrics using devices directly from home to basically predict worsening of conditions proactively and bend that causality more towards keeping their outcomes better.
Mm-hmm.
So being proactive in healthcare has definitely given an edge. We have been doing this renewed care model for, I would say, in last 3 years, and definitely we have seen improved satisfaction outcomes. And now we are just trying to scale up the operations across Arizona in different communities.
Yeah, and how can we do that? The other thing I love so much about the work that I get to do is that I have a very broad and wide close-knit network of folks who are leaders, again, from our politicians to our universities and enterprise level to small businesses. How can I help a company like you continue to grow and let people know who are you looking to stay connected with?
So in healthcare, there are multiple, stakeholders, and some of it is complex. So definitely we are looking for community leaders who have a healthcare needs, would love to work with them and bring some solutions. So there are employer groups who are looking for innovative solution on whether it's on-site clinic, help with managing their medical costs. We have a solution for them. So what we have done is basically over the last 5 years, trying to promote this value-based care setting. Now we can go after different population buckets. So we have a strong program with employer value-based program.
Mm-hmm.
We have a very robust program for our seniors, which is typically the Medicare Advantage, where we work with health plans as well as directly with Medicare to manage the population better in innovative ways. We work with payers as well as health systems. So we see that we are all in this to basically improve the health of our community, and working collaboratively together, we can create value. So for us, we are happy to work with other leaders, and innovation comes or disruption comes when differing specialty come together. So definitely we are looking for, I had a chance to meet with somebody working in AI space, and we were able to utilize some of the AI, AR technology to create smart clinics, where we partnered with Safeway Albertson to open access point where one provider can manage up to 10 locations. So it improves access, brings care in the community. And so these are some innovations which basically over the last 5 years, we have been able to develop working with local community, where we were able to collaborate and work on basically picking us a problem and creating a solution.
I mentioned this before we went on air, but it's worth mentioning again. I'm very excited about introducing you to Steve Zylstra with Arizona Technology Council, because that's the very thing that he and his organization do, making sure that everybody knows what everybody else is doing, so that magic can happen, that innovation, that spark. One challenge that somebody else may have, you've already got the answer to. So let's get you connected. So I'll make sure I make that introduction, and who knows, maybe we'll have you on our Arizona Tech Cast show again at another point in time. Let's go back to our seniors, and really, I want to highlight or ask two other areas so that we can highlight these. Tell me, are there any updates that you're aware of around Medicare and the Advantage in 2021? What's coming up for Medicare in 2021?
As you know, as part post-COVID, there have been a lot of changes. So Medicare basically works through third-party entities to create Medicare Advantage products. And we have some new entrants in the marketplace, which are more innovative, like Devoted Health, which is a new Medicare Advantage plan, which we have partnered with and has some very innovative solutions in how they care for the patients. So that's something new to Arizona. But Medicare has done certain critical needed steps to improve improve access to care in times of COVID, like telehealth. Telehealth was earlier prohibited in Medicare unless you're in a remote setting. And now basically they have opened it up, and that has definitely, in this critical pandemic time, improved access to care for our seniors. And Medicare truly is one of the most innovative and front-looking organization under strong leadership, and they have a very good vision to improve, and they have been very innovative in terms of looking at different solutions which can bring better care to our seniors. And as I said, we are participating with them on several programs, including direct contract entity, where we work with them to bring innovative solutions to create a care model which is unique for our seniors in Arizona. And healthcare is very regional, Karen, because every population is different. Every geography is different. So some things which work in Arizona may not work well in Montana or New York. So definitely understanding the local fabric and care delivery and basically creating a local model what's best. And from there on, there is the scalability where you can use some of the standards in other places, but you have to truly to be a good solution. It has to work in the local and regional setting.
And that's, you mentioned this phrase, direct contracting entity. That's what you're describing. Can you tell me, what does that mean then? It's a company like you who's there to advocate for the patients, or?
So currently in the model, Medicare was paying basically multiple physician, multiple specialists, and the hospital for the care delivery. Okay. In this situation, they partner with entities like Apricus, which has the network and basically allows us to bring innovation in care delivery and bring better care model and work with us to basically showcase the savings in this model.
It's streamlined. It's all there. Yes.
Care coordination, care navigation, chronic care management. So they allow us to innovate and basically create a better care model for the community.
Very good. Wow. So you shared with us a little bit about your journey into medicine and having started in India and then coming to the States. I know that you serve on a couple different boards. Tell us a little bit about what you do professionally. Would love to hear a little bit more about you as you show up in this space and are a leader for us.
When I was in med school, I had two nonprofit organizations which I was leading, one around healthcare and one more on social issues. And definitely in my journey, as I said, still practicing physician, a cardiologist, and practicing in the state of Arizona, still seeing patients. On the other side is this healthcare entrepreneur who looks at challenges in healthcare and tries to find solutions. That between two of those, that keeps me busy enough. But we have created a foundation under Apricus, where again, our goal is to address some of the disparities around healthcare in our communities and basically create solutions to decrease some of these disparities and, as you said, improve access to care in our community. So we are working on some of those pieces. We are also, with a young family, with a couple of offerings which I can put on the table, I try to spend some time also on bringing some value to some of these boards, on charity boards, where I can be an advisor as well as kind of, a board member to guide and vision for bettering the healthcare of the community.
Do you ever sleep? You're a very busy man.
So this is what excites me. This is what keeps me going. And this is my passion. As I said, I'm a physician by heart, but entrepreneur by passion. And that's what I like to do and if I can make a small difference to somebody's life, that goes a long way. That's what, basically is the gratification. And so definitely I've enjoyed the journey, learned a lot from people around me. And if we can help each other truly as humans, I think we should do that. And this is the time where I know I'm not a political person, but truly I feel, and as I said, I've been exposed to multiple continents, multiple societies. I feel the greatness. America is one of the greatest nations, brings a lot of innovation for everybody. And what makes it great is the people like us who come together and find solutions. And that's where we have to focus on continue to creating solutions, whether it's around healthcare, technology, and work together. And that's the spirit which we should move forward to. And I hope the country basically is able to get above the party lines and find solutions for the future.
That's my hope as well. You'll hear at the close of our show, I have this little saying, and I think you'll appreciate it because we stay very bipartisan as well. We want to hear, from everybody. How can we raise the vibration and bring everybody up? One of our sponsors is Conscious Capitalism. It's a nonprofit, a worldwide nonprofit, and really on the premise that, listen, capitalism is not an awful thing. The fastest way to take care of abject poverty is through teaching people how to build businesses and earn money, have an income. So the word conscious and capitalism can go hand in hand. And that's exactly what we're speaking about today. How can we be conscientious and conscious, give back, involve all stakeholders, help our community, help folks worldwide, in addition to it's okay to make money while we're doing it. We're not robbing anybody to do it, but we have to sustain, we have to thrive, and there's enough for everybody to go around. So I certainly feel like we're kindred spirits in that regard. Tell me a little bit about your childhood growing up. What I'm curious about is, did you always know that you wanted to go to medicine and become a doctor? And you mentioned that there's been, of course, great influences in your life. Who really helped you shape who you are today?
Again, that's a profound question, which I kind of give a lot of thought. So again, my parents have been my role model. So my mom and dad, both, the upbringing comes from your childhood and people around you. So definitely that's the formative years and the support you get from your family, the siblings, the parents. They basically, I feel it's a very critical, along with everybody else in the family and society, is what shapes a child. Mm-hmm. And so I was lucky to have a strong family who was very supportive and helped build some of the principles inside me, which basically I've been able to carry on and use that to do some good to the world. And that's, if I can bring some value, that's what I've been able to. So definitely, I grew up in India. My dad was an MBA grad and kind of very innovative. My mom was a teacher, so got both sides. Yeah. So as an educator, she was always focused on doing the right thing and those principles. And my dad was more of gave the entrepreneur side of thinking how we can what are some of the innovative things you can evolve. So that was, I think that both their influence is critical in where I am today. They were very supportive. So I grew up in a part of India called Bihar. From there, I moved to New Delhi, which is where I went to for schooling, did my med school there. From there, the next journey was to Columbia, New York. And as you can imagine, New York is a great, very different place. So it takes time to adjust, very fast paced, but you learn a lot. It's a basically hot pot of international global community. So you get great exposure at the same time. There's a lot of learning. So it was those 2 years were very formative, a lot of learning, and I could really pull together a lot of get a more of a global viewpoint on things. So that was very formative. From there, I went to Omaha, Nebraska. So moving from New Delhi to New York was not a big culture shock, but moving from New York to Omaha was a culture shock, and that took a while But then Midwest grows on you. The people are so nice and so accepting and really appreciative, especially in healthcare. So all my 3 kids were born in Omaha, Nebraska. So Go Huskers that was another formative part of the life where was able to see the local culture in the Midwest setting, formed my family. From there on, moved to California, did some education, and then finally ended up in sunny Arizona. And Arizona has been the foundation to a lot of the newer innovation which I've been able to do. So I'm very thankful to the Arizona community. They have been very supportive. Got a lot of backing from friends, family, and community to be able to do what I'm doing. So it's truly, you take the lead, but you need the support of your friends, community, and family. And my wife has been very tolerant, as you said, of my, that support allowed me to do some of these things, which becomes very hard when you have a young family. So.
Oh, for sure. And I shout out to your beautiful wife who's been tolerant. I love that. And as an entrepreneur and a business owner and an active physician, you've got to have that support and oftentimes that encouragement, right? For that day you melt in bed and think, oh my gosh, I can't do one more thing. And by the way, how have things gone on here at home today? Thank goodness we have family who care and give us that space to be creative, to be innovative, and to be a leader. It's funny, my daughter is 24. She works for Red Bull. She moved to Brooklyn, New York, a year ago, knew that placement for her was just for 1 year. But my little Arizona girl in New York, working with restaurants and bars and the role that she played was such a change for her. Now, she ate it up like you described. She loved it. I think maybe everybody ought to spend a year working in New York, no matter where they're coming from. She's now back home and is now representing Red Bull throughout the state. But she loved, just as you described, it was an opportunity for her to really grow up and get to know people from so many different cultures and different walks of life and really become independent. It was really kind of neat. And Mom's also really happy that she's here back at home and stayed healthy throughout the pandemic. As a young boy, Dr. Anand, did you always know medicine was for you, or did you have a dream to grow up and be someone different?
So when I was in high school, my dad sat me down. I remember this conversation where my dad, as I said, he's an MBA grad. He said, son, and you're smart. I think you are well suited for business, and you need to get into, you should pursue an MBA, and you need to focus on commerce, economics. And I was like, no, Dad, I want to be a physician. That I remember that 2-hour conversation. And again, he was of the perspective that for your future family, the commitment is much more in healthcare. It's a very long career through the med school, residency, cardiology, and further specialization. So he was coming from that perspective, but I had a passion for healthcare. And then again, after that conversation, he was very supportive, and I was lucky enough to get into a med school and make the journey till here. So that there was a passion around healthcare. As you can imagine, I was good with computers. I had other options, but from early age, I knew that healthcare was where my heart was, and still today is. And most of the initiatives which I have done is all around healthcare, because that's one area I'm very passionate about. And I feel like, coming together, we can find solutions.
For sure. And I hear this teacher in you. So you've got your mom. I hear that great educator in you. I hear the entrepreneur and the business owner from your dad. And of course, the passion that you had from a very young age around medicine as well. So it's wonderful to see the blend of all the influences that you've had and that you were able to share with us today. Is there anything that I hadn't thought to ask that you'd like to share with us before we close out our segment?
No, Karen, thank you so much for making the time for us, and hope the listeners get some value from our discussion, because I think definitely as a country, we all need to put our heads around solutions. So I hope, if we can bring some influence in somebody's life, it'll be worth both our times.
For sure. Well, thank you again. Folks, you can find Apricus Health online. It's Apricus Health, AP as in Paul, RICUS as in Sam, health.com. Also on LinkedIn, Facebook, and Twitter. And then, let's see, ACOS, we would also have this, is that ACOS.com?
ACOSMD.com, AKOSMD.com.
MD.com. Okay, great. And are you on LinkedIn as well, or do we just reach out? You are as well. Wonderful. Well, thank you again for being here. Stay with me after we go off air so I can properly thank you individually and take a couple of photos. You've been listening to Phoenix Business RadioX, again, broadcasting live from the Mac 6 Conscious Workspace right here in Tempe, Arizona. Some media leans left, some lean right, and we lean business. Until next time, I'm Karen Nowicki. Thanks again for listening.